Why does your throat still feel coated even after you have cleared it for the 10th time today? And why has no one ever given you a real answer for it? Before we go any further, do me one small favor. Tap that like button right now, not later, not after you decide if this video is good, but right now as a promise to yourself that you are going to sit with this information until the end. Then hit subscribe, because what I am about to share is part of a much bigger conversation about aging well, and you do not want to miss the rest of it. And if you know someone who carries a water bottle everywhere because their throat never feels clear, send them this video the moment it is over. It might be the most useful thing you share with them all year. Now let's talk about what is actually happening in your throat, because almost nobody has explained it to you properly. Think about how long this has been going on. Was it a year? 2 years? Longer? Most people cannot pinpoint the exact day it started because it never arrived all at once. It crept in. A little throat clearing here, a little extra swallowing there, and slowly it became background noise in your life. You stopped mentioning it to your doctor because it did not feel like an emergency. You just adjusted. You started keeping water nearby. You stopped eating certain foods before bed. You tried lozenges. You tried tea with honey. Maybe you even tried cutting out dairy because someone told you that was the culprit. And yet here you are, still clearing your throat. I want to tell you something that might change how you see this completely. Your body is not malfunctioning randomly. It does not produce extra mucus for no reason, the same way it does not raise your blood pressure for no reason or make your knees ache for no reason. Every one of these things is a signal. Your body is trying to tell you something specific, and the mucus sitting in your throat right now is a message, not a mystery. The problem is that almost nobody takes the time to translate that message. Doctors are busy, appointments are short. You mention the throat thing, you get handed a spray or told to drink more fluids, and you are sent on your way. Meanwhile, the actual cause, the thing actually driving this day after day, is sitting there untouched. That changes today. I'm going to walk you through the real, research-backed reasons why people past the age of 55 deal with this far more than younger adults do. And I am going to show you how 2 or 3 of these causes are very likely working together inside your body right now, quietly reinforcing each other, which is exactly why nothing you have tried so far has fully worked. Before we dive in, let's get one piece of biology straight, because once you understand this, everything else will click into place. Your body makes mucus all day, every day, whether you are sick or perfectly healthy. This is not a flaw. It is one of the smartest defense systems you have. A thin layer of mucus lines your nose, your throat, and your airways at all times. It traps dust, bacteria, viruses, and pollution particles before they can travel further down into your lungs. It also keeps the delicate tissue in your throat soft and protected, the way a coat of oil protects metal from rust. Without mucus, your throat and airways would dry out and become cracked and vulnerable almost immediately. So mucus itself is not your enemy. Your enemy is what happens when that mucus is not cleared the way it should be. Here's the part of this story that almost nobody learns until it becomes a problem. Lining your airways are millions of tiny hair-like structures, so small you could never see them, called cilia. Their entire job is to move in a constant rhythmic wave, sweeping mucus upward and out of your airways before it has a chance to sit still and thicken. In a younger body, this sweeping motion is fast and efficient. Mucus barely has time to pool before it is cleared away. But research shows that as we get older, those same cilia slow down. They beat less often and they beat with less force. The sweeping system that used to clear mucus within minutes now takes hours to do the same job. So the mucus that would have disappeared quickly at age 35 now lingers, thickens, and becomes something you notice, something you feel sitting at the back of your throat, something you have to consciously clear. This single fact explains why this symptom becomes so much more common after 55. It is not that your body suddenly starts producing more mucus out of nowhere. It is that whatever is pushing your mucus production upward now has a much harder time being cleared. The traffic light system that used to move mucus along smoothly has slowed down, and any extra mucus you produce now sits in a long line backing up. With that foundation in place, let's talk about the actual triggers, the things that are pushing your mucus production higher than it needs to be in the first place. The first one is, by far, the most overlooked, and in my experience, it is the one responsible for more cases of this than people realize. It is called silent reflux, and the word silent is the key to understanding why so many people miss it entirely. Most people know what regular acid reflux feels like, a burning sensation behind the breastbone after a big meal, sometimes a sour taste rising up. That is the version everyone recognizes. But there is a second, sneakier form of reflux that produces almost none of those classic warning signs. No burning chest, no sour taste. Just a throat that never seems to settle, a voice that sounds a little rough in the mornings, and mucus that seems to build up overnight while you sleep. Here is what is actually happening inside your body. Where your esophagus connects to your stomach, there is a ring of muscle that acts like a one-way gate. After you eat, that gate is supposed to stay shut tight, keeping stomach acid exactly where it belongs. As we age, that muscular gate can weaken, the same way any muscle can lose strength and tone over the years. When it does not seal completely, tiny amounts of stomach acid can creep upward, past the esophagus entirely, and reach all the way into the throat and even up toward the back of the nose. Now, here is why this matters so much for your throat specifically. The lining of your esophagus is built to tolerate some acid exposure. The lining of your throat is not. It is far more delicate, and even a small trace of acid touching that tissue triggers an alarm response. Your body's solution is to flood the area with thick protective mucus to shield the irritated tissue. This happens night after night while you sleep, completely silently, with no chest pain to alert you. You simply wake up every morning already feeling that thick coating at the back of your throat, with no obvious explanation. This is far more common than most people realize. Studies looking specifically at this condition have found that roughly half of the people dealing with it report zero heartburn whatsoever. No burning, no discomfort after meals, just chronic throat clearing, a scratchy morning voice, and mucus that seems to peak right when you wake up. Ask yourself honestly, is your throat noticeably worse the moment you get out of bed compared to later in the afternoon? Does bending over or lying flat seem to make it worse? Does your voice sound a little hoarse for the first hour of your day before it clears up? If you answered yes to any of those, silent reflux deserves a serious look, and later in this video I will give you specific steps that target this exact mechanism. One more thing worth flagging here. If you regularly take anti-inflammatory pain relievers, things like ibuprofen or naproxen for joint pain or arthritis, research has shown these medications can weaken the stomach's natural protective lining. That makes any form of reflux, including the silent kind, considerably more likely. If that sounds like your situation, it is worth mentioning to your doctor directly, because that connection often goes completely unspoken in a typical appointment. Quick pause before we move forward because I want this to actually stick with you instead of just playing in the background. If something already clicked for you, tap that like button right now. It genuinely helps this reach more people sitting in the same situation. And answer me honestly in the comments. In one word, has this been going on for months, years, or decades? I want to see the real number. The second major driver behind that constant throat sensation comes from somewhere you might not expect, your sinuses, even when they are not giving you any of the dramatic symptoms you would associate with a sinus problem. When people picture sinus trouble, they imagine a full-blown infection, intense pressure behind the eyes, a pounding headache, a completely blocked nose. But for a large number of adults in their 50s, 60s, and beyond, sinus inflammation shows up in a much quieter way. Breathing feels mostly normal. There is no dramatic headache, but the sinuses are mildly inflamed and producing slightly more mucus than they should, and that extra mucus drains slowly and continuously down the back of the throat, hour after hour, day after day. This is known as post-nasal drip, and it is one of the most under-recognized causes of that persistent throat sensation in this age group. Here is the frustrating part. So many people in this exact situation reach for an antihistamine from the pharmacy, assuming it must be allergies. Sometimes it offers brief relief, but antihistamines are designed to dry up mucus temporarily. They do almost nothing to calm the actual inflammation happening deep inside the sinus tissue that is causing the excess production in the first place. And dried out, overly thickened mucus stuck at the back of the throat often feels even more uncomfortable than the wetter version you started with. The approach with the strongest research support here is refreshingly simple and inexpensive: regular nasal rinsing using warm salt water. Multiple clinical reviews have found that nasal irrigation is a safe, effective, low-cost way to manage chronic sinus and nasal inflammation, and it is recommended by ear, nose, and throat specialists around the world as a supportive part of treatment. Here is why it works so well. A proper saline rinse physically flushes out inflammatory mucus sitting in the sinuses, reduces the swelling in that tissue, and helps support the natural sweeping action of those tiny cilia we talked about earlier, the very system that slows down as we age. If you commit to doing this daily, you are essentially giving your sinuses a daily reset. The word that matters most here is consistency. Doing it once or twice will give you a day or two of mild improvement, and then you will likely give up on it because it did not feel life-changing. But used correctly every single day for a couple of weeks straight, this becomes one of the most genuinely effective habits you can build for this exact problem. I will walk you through exactly how to do it properly in a few minutes. Now let's talk about a cause that genuinely surprises people because it is hiding somewhere they never think to look, inside their own medicine cabinet. There is a very common category of blood pressure medication called ACE inhibitors. You may know them by names ending in pril, like lisinopril or enalapril. These medications are prescribed to millions of people every single year, and for good reason. They work well, they are generally safe, and they play an important role in protecting heart and kidney health over the long term. But there is a well-documented side effect connected to this entire class of medication that rarely gets discussed openly. These drugs cause a substance in the body called bradykinin to build up more than it normally would. In a meaningful percentage of people, somewhere between 5 and 20% according to published research, that buildup leads to ongoing throat irritation and a persistent urge to clear the throat. This is not an allergic reaction. It is simply a known mechanical effect of how the medication works, and your throat happens to be one of the tissues sensitive to it. Here is what makes this connection so easy to miss. The irritation does not always show up right away. It can take weeks, sometimes even several months, after starting the medication before the throat symptoms begin. So if you started a new blood pressure pill 9 months ago and your throat began bothering you 7 months ago, your brain never links those two events together. They feel completely unrelated, even though research shows this exact delayed pattern is extremely common. One large study following more than 27,000 patients found that adults over the age of 65 had a significantly higher chance, more than 50% higher, of experiencing this throat-related side effect compared to younger patients taking the same medication. That makes this conversation especially relevant for you. If you take a blood pressure medication and you are not sure which category it falls into, your pharmacist can tell you the answer in under a minute, often just by glancing at the bottle. And if it does turn out to be an ACE inhibitor, there is good news. There is another widely used category called ARBs, angiotensin receptor blockers, that control blood pressure just as effectively without carrying this particular throat-related side effect. Bringing this up with your prescribing doctor is a completely reasonable, low-risk conversation to have. Stick with me because we still have 2 more causes to cover, and the second to last one might be the most surprising of all. Let's talk about something so basic that most people dismiss it as too obvious to actually be the problem: hydration. But I promise you, the way it connects to mucus is more interesting than you think. Mucus is mostly water. Whether it feels thin and easy to swallow or thick and sticky and stuck in place depends almost entirely on how well hydrated your body is at that moment. Picture honey straight out of the fridge compared to honey left out in a warm kitchen all day. Same substance, completely different texture and behavior. Your mucus responds to your hydration levels in almost exactly the same way. Here is the twist that makes this more relevant to you specifically than it would be to someone in their 30s. Research has shown that the body's thirst signal becomes noticeably less reliable as we age. A younger person feels thirsty well before they are actually dehydrated, giving them an early warning system that works reliably. In older adults, that warning system becomes blunted. You can be mildly dehydrated enough to thicken your mucus and make your throat feel worse, without your body sending you any clear signal to drink more. This means that waiting until you feel thirsty puts you constantly behind. By the time thirst kicks in, if it kicks in at all, you have likely already been mildly dehydrated for hours, and your mucus has already thickened in response. A commonly referenced hydration target in clinical nutrition guidance is roughly 30 milliliters of fluid per kilogram of body weight per day, counting water, herbal tea, soup, and water-rich foods. But the real key is not hitting a perfect number. It is drinking consistently throughout the day, rather than only when thirst finally shows up. This single shift, drinking on a schedule instead of waiting for thirst, is one of the simplest and fastest ways to notice a difference in how thick or thin your mucus feels. Now for the 5th cause, and this is the one that almost never gets mentioned in conversations about throat mucus, even though the research behind it is genuinely fascinating. For a meaningful number of people dealing with this persistent symptom, the real root cause is not in the throat, not in the sinuses, and not even in the stomach. It is sitting in the gut. Here is what the science tells us. Your digestive system and your respiratory system are far more connected than most people realize. They communicate through shared pathways involving your immune system and your nervous system. The trillions of bacteria living in your gut, collectively called your gut microbiome, play a direct role in how reactive and how inflamed your upper airways become. When that bacterial balance gets disrupted, something researchers call dysbiosis, it can trigger immune responses that increase mucus production in your airways. Not because anything is physically wrong with your throat, but because your gut is sending inflammatory signals that your respiratory system is responding to. This connection, often referred to by researchers as the gut-lung axis, is an active and growing area of study. Several peer-reviewed studies have confirmed that disruptions in gut bacteria can trigger immune responses that increase inflammation in the airways. In one striking study, researchers transferred gut bacteria from patients with chronic lung conditions into laboratory mice, and those mice went on to develop measurably higher airway mucus production, even though nothing had changed about their lungs directly. That is about as close as research gets to proving a direct causal link between gut health and what happens in your throat and airways. Here's a quick gut check for you. Answer with just yes or no in the comments. Have you taken antibiotics more than twice in the last 5 years? I have a feeling the answer is yes for more of you than you'd expect, and that number matters for what I am about to say next. What typically disrupts gut bacteria as we age? A diet low in fiber and fermented foods, repeated rounds of antibiotics over the years, high sugar intake, and chronic stress. None of these are rare or unusual. They describe daily life for a huge number of people in this exact stage of life. You will not solve a gut-driven mucus problem with a lozenge or a cough drop, but you absolutely can start supporting your gut, and in a moment, I will show you exactly how. Before we get into the full action plan, I want to pause for something important, because your well-being matters more to me than finishing this script smoothly. In the overwhelming majority of cases, persistent throat mucus is exactly what we have been discussing: manageable, explainable, and not dangerous. But your body sometimes uses a symptom like this to flag something that needs a doctor's attention right away, not a home remedy. Please book an appointment promptly if you notice mucus that is tinged with blood, even just a little, difficulty swallowing that keeps getting worse over time, unexplained weight loss alongside your throat symptoms, a lump or swelling anywhere in your neck, or a change in your voice that does not go away after a couple of weeks. These signs go beyond what we are covering today, and they deserve a real medical evaluation, not a video. Now here is your action plan, the part where everything we just covered turns into something you can actually start doing tonight. Stop eating at least 3 hours before lying down. When you eat right before bed, your stomach is still hard at work digesting, and that muscular gate we talked about earlier struggles to stay sealed while under that pressure. Giving yourself 3 full hours of upright digestion time before bed is one of the most well-supported behavioral changes for reducing nighttime reflux. Raise the head of your bed slightly. Do not just pile extra pillows under your head, because that bends your neck at an awkward angle without actually helping. Instead, place a sturdy wedge or a few books under the legs of your headboard so your whole upper body is gently inclined. Even a small amount of incline lets gravity help keep stomach acid where it belongs while you sleep. Tonight, before bed, drink a full glass of warm water. This small habit supports hydration through the night and helps keep your mucus thinner, so you wake up with less buildup waiting for you. Tomorrow morning, before your coffee and before breakfast, drink 1 or 2 glasses of plain warm water first thing. This costs nothing, takes 2 minutes, and immediately starts loosening whatever accumulated overnight before it becomes the centerpiece of your entire morning. Pick up a nasal rinsing device from any pharmacy, either a neti pot or a simple squeeze bottle. Use water that has been boiled and then cooled to a comfortable warm temperature, never straight from the tap. Add a small pinch of plain salt and, if you like, a tiny pinch of baking soda, which can help gently neutralize acidity and thin out mucus. Use this once a day, ideally in the morning, and give it a full 2 weeks before deciding whether it is working. Consistency is the entire difference between people who say this helped and people who gave up too early. Book a separate appointment specifically to review your medication list with your doctor, with your throat symptoms in mind. Before you go, write down a simple timeline, when your throat symptoms started, and when you started or changed any medications, especially blood pressure pills. Ask directly whether you are on an ACE inhibitor and whether switching to an ARB might make sense for you. Start adding 1 small daily serving of a fermented food into your meals. Plain yogurt with live active cultures, kefir, a small spoonful of sauerkraut or kimchi. These foods gently support a healthier, more diverse gut microbiome over time, and research increasingly links that diversity to lower airway inflammation. This will not change anything overnight, but small, steady habits like this one are exactly what shift your baseline months from now. Keep water within arm's reach in every room you spend time in and set a few reminders on your phone throughout the day if you tend to forget. Add more water-rich foods to your meals too. Cucumber, watermelon, soups, and herbal teas all count. Within just a few days of doing this consistently, many people notice their throat already starts to feel less heavy. A quick word on a few popular home remedies because I know many of you have already tried some of these. Honey genuinely does soothe irritated throat tissue, and there is nothing wrong with using it, but it will not touch any of the 5 underlying causes we discussed today. As for dairy, the science does not actually support the idea that it creates new mucus out of nowhere, although some people do notice their existing mucus feels thicker after consuming it. If you suspect that pattern in yourself, a short 2 to 3 week trial of cutting back is reasonable. And apple cider vinegar, often recommended online, can actually make things worse if silent reflux is part of your picture, since you would be adding more acid into a system that is already struggling to keep acid where it belongs. You have made it through every single cause, and that tells me you are serious about finally understanding your own body instead of just managing around it. If even one part of this video gave you a piece of the puzzle you were missing, do something simple for me. Think of one person in your life, a parent, a sibling, a friend, anyone who has been quietly clearing their throat for years without an answer, and send this video straight to them right now before you forget. It takes 10 seconds, and it might be the thing that finally helps them understand what their own body has been trying to tell them. Here is what I want you to remember above everything else from today. That coating sitting at the back of your throat is not a mystery, and it is not simply something you have to accept as part of getting older. It has a reason, often more than one reason, working together. Silent reflux acting while you sleep, with none of the obvious warning signs you would expect. Quiet sinus inflammation draining steadily without ever announcing itself with a dramatic headache. A blood pressure medication doing exactly what it is designed to do, while quietly irritating your throat as a side effect nobody warned you about. Hydration running just low enough, day after day, to thicken everything without you ever feeling clearly thirsty. And a gut microbiome sending inflammatory signals to airways that seem, on the surface, to have nothing to do with digestion at all. None of these require you to simply live with this for the rest of your life. Every single one of them has a real, practical, evidence-based response, and most of the first steps cost you nothing more than a glass of water, a pinch of salt, or one honest conversation with your doctor. What they require from you is not a prescription. They require attention, a little consistency, and a willingness to treat this symptom as information instead of an annoyance to push through. If anyone has ever told you this is just what happens when you get older, I hope today gave you a reason to question that. You are not just getting older. You are dealing with something specific, something explainable, something you can actually do something about, and you deserve to know that a long time ago. Make sure you are subscribed with notifications turned on, because there is another video coming very soon that goes even deeper into how your gut influences inflammation throughout your entire body, not just your throat. That conversation builds directly on everything you just learned today, and you will not want to miss it. And before you go, I want to hear from you. Of the 5 causes we covered today, which one hit closest to home for you? Tell me in the comments, along with how long you have been dealing with this. I read every single comment, and your story might be exactly what helps someone else watching this finally feel understood.